you doing today?
Hi, I'm doing very well. How are you?
I'm doing good. So, can you tell us a little bit about you and what you do?
Absolutely. So, I work for Family Compass and I run the organization. We've been around since 1992, and there's about 20 of us between Dallas and Collin County. And our mission is to prevent child abuse and neglect before they can happen. And we do it with two types of programming: in home mentoring, where we normally go out into the homes and work one-on-one with parents and children around parenting best practices, activities, helping them reduce stress in the home, which we know is a key factor, helping them with supports and resources to address living and community issues, which is another stress factor, and then just really helping them understand what parenting looks like, and that lowers their level of stress. And stress is such a huge factor in child abuse and neglect. All those risk markers, we directly address those, not only through that programming, which is in home mentoring, but also we do parenting classes in the community as well, which also accomplish those same activities and goals, which lower stress in the home.
That's great. So, you mentioned this at home mentoring kind of program. Is that going to be changed due to the circumstance, or are you guys just going to wait out the pandemic?
We immediately changed.
Okay.
So we already, one of the biggest barriers for the families that we work with, many of whom live in poverty stricken areas, is transportation. And so that's kind of the beauty of what we do, is we go out to them, and so they don't have to travel to us. And so the transportation piece is always big. And now what we did is switch to doing everything virtually or over the phone. And so we're providing the same services, but the tricky part is it's different for every family. So what my staff have had to do is, for every single family we work with, whether they're in parenting classes or we've been working one-on-one in in-home mentoring with them, many for a long, excuse me, long period of time, is to meet with each family and ask them what's going to work best for them. So we're tailoring our response to every single family that we currently serve. And so many of them are capable of doing some sort of virtual, maybe on their phone, FaceTime. Some of them can do like a Zoom meeting like you and I are doing right now. Some of them have to do a phone call because some of them don't even have internet. So we have a wide range of technology capability, but whatever we've got to work with is what we're working with to continue to provide the services and the support which they gravely need right now.
Yeah, that's really great. Okay. So, what are some of the effects that quarantine could have on family life? I know you mentioned stress being a huge factor of abuse. Do you feel like the stress of quarantine could affect this?
Absolutely. And we saw it very quickly, very early on, when we were just reaching out to them to just even set up schedules and ask them what their technology capacity was. We immediately were in crisis response mode with them. So they were debriefing with us. We were validating their experience. They had the children at home. All of their routines were thrown off, which was creating stress. Some of them had lost jobs or had someone in the household had lost a job. So there's this collective societal stress going on that's just accumulating as we go through this pandemic, that's building in these households. And we have multiple generations of families living together. And so there's a lot of chaos that's happening. Everyone's sort of out of the norm. And that uncertainty of the future, the uncertainty of the day to day, that creates a lot of stress, not only for adults, but also for children. Children like to have routines. And so when we reach into these homes, that's one of the biggest things we've been doing, is helping parents take a step back and say, okay, you had a routine, you can recreate a new routine. And that's really important to help lower the stress inside those homes. But it's absolutely, everything is spiking right now. And when you're living in poverty and you have uncertainty about where your next meal is coming from, combined with the kids are at home and how do I handle the schoolwork if they're school age, how do I handle them just being underfoot all the time and wanting my attention? So there's a lot of escalating pieces to this that are driving those risk levels to be much higher than they normally would be.
Okay. Um, so you said that you see an increase. Is there any proof of there being an increase of child abuse during this time?
Well, I think the concerning thing is that it's a little bit anecdotal. And so I think it's kind of this silent echo crisis, as we've been talking about it, running concurrently alongside the pandemic that we're all experiencing. A lot of the children that we work with are, I mean, they're between ages 1 and 5. And so they don't even have a teaching environment happening in their home. And so for us, we may be the only eyes or ears or support resources kind of coming into that home from the outside world. And so we absolutely know that isolation in these environments where stress is escalating, the child abuse is spiking, domestic violence is spiking. Those numbers are up. We certainly know that because we're seeing the reach out into the domestic violence community, and child abuse follows domestic violence in 40 to 60% of the cases. And that's just a known number, which is probably low. So all of it's sort of tracking and trending. And as we come out of this and we really start to have professionals who are kind of boots on the ground, figuring out what's happened during this time, I think that we're going to have a lot to deal with on the back end. And so that's our biggest concern. And so as we're working one-on-one with families, many of whom, like I mentioned, we do have long-term relationships with, seeing if there's risk markers that are escalating is something that we'll be able to tell and hopefully get in there and really lower those stressors and prevent them from having to come out of this and go into an intervention, which would be going into the system.
That's a lot for somebody to have to make sure that the stress markers stay down so that they don't go into the system. That's a huge jump.
Yeah, and I think that it's just this it's this silent and private epidemic. I think, when you're talking about child abuse and domestic violence, these are the things that happen behind closed doors. And when you don't have someone in a professional capacity or even an outside capacity, a coach, a teacher, someone at the church, when you don't have someone who is involved with the family during this social distancing, there's no eyes on the family. And that's the scary part, is really what's going on in homes across our community and across communities and across the entire nation.
Yeah, it is scary. So I know that we all want to help, right?
Mm-hmm.
What are some ways that the community could help with preventing child abuse? What does prevention look like?
Yeah, and I wanted to touch on that a little bit earlier. I'm glad you kind of came back around to that. So, the prevention aspect of this is really getting in and giving parents and kids a chance. And so that's really what our mission is all about. Let's get in and figure out what it is that families need to give them a chance to do things differently, to see things differently, to learn different things, and to really build their capacity. Because once you build your capacity and you start to feel more competent, those levels of stress start to drop. And so for us, it's really teaching them what good parenting even looks like. No one comes out of the hospital with their child with a to-do manual. And so we really kind of go in hands-on and help them with that. So that's what we're doing, is still continuing to help them learn what parenting looks like, tips and tools and actual activities that they can use with their children. And so we're still doing that. But for those in the community, to help those families that are struggling, it can be pretty simple. And I've talked about this on some other interviews as well. And it can really just be checking in, whether it's the phone call or a quick FaceTime, or even just a wave from across the street, and letting them know that you care about them and if you can talk to them about how they're taking care of themselves. I think that for us is one of the biggest pieces, is how are parents in the midst of all of this putting their own oxygen mask on, the analogy of being on the airplane, and
Yeah.
how are you really taking care of yourself, and what does that look like for you? What are your stressors right now? And they're very individualized to how everyone is responding to this pandemic. And I think we're in a phase right now where it's gone on long enough that people are fatigued by the actual abnormal normal that we're all in. And so it's really important to just check in and help people articulate what they're going to do to take care of themselves, because a lot of people are not even thinking about that, and I think that's where things can get pretty shaky.
Yeah. And do you have any advice for families that could be struggling with their kids or having a lot of stress, not knowing how to balance everything?
Absolutely. And there's a lot of resources out there. And I don't know in terms of your audience, but I've got some tip sheets and some things we can send out. Family Compass has been posting them on our Facebook page and in social media. A lot of agencies have come out with a lot of really great tools. And we've got one, we use Triple P parenting classes, and they have some really great just tip sheets. And it talks about reestablishing routines for children so that they understand what's going to happen next. So there's a lot of uncertainty with kids. And when you can take the uncertainty out of the equation, it helps children settle down. It helps them feel more safe, protected, and they also want attention. I think that's the other piece of this, is that kids, they want to be seen. I think we all do, right? And so it's kind of, I don't know, it's kind of a simple equation of reassuring children. And even if you don't know the answer, and if you don't know what's going to happen, talking with your children and saying, I don't really know what the next few weeks are going to bring, but I do know that I love you and I'm here for you, and we're going to get through this okay, and this is how we're going to do it in our household. And if the children are older, you can involve them in those conversations. What are they going to do to establish routines throughout their day? What do they want that to look like? And sit down with your kids and really have a conversation and acknowledge the fact that this is a really weird time right now, and we all need to be thinking about what's going to help us feel stable. And for kids, it's really reassuring them, paying attention to them, really dialing in and being present in the moment with them, so that they are not grasping for your attention
Yeah.
all the time. And that's what kids want. They want your attention. And I mean, quite frankly, it's what adults want too, right? So
Yeah.
you're reaching out to your friends, it's the same thing. Be very present, but modeling that for children and doing it for children is really, really important.
Yeah. It's as simple as, how are you doing? What are
Yeah.
you playing?
Mhm.
Um, I guess that we forget one of the best things in this life is nurture. So
Yeah.
even if nature isn't where we want it to be, we can always nurture. And that's a huge aspect of development.
Yeah, I think you bring up an excellent point, and it's that piece of also letting your kids know that they can come to you, because they may be okay one minute and then something else happens, and really letting them know they can come to you and let you know they're not doing okay. It's just keeping that communication, those lines of communication open. And so that even if you as the adult in the household, they're going to pick up on your stress, and we're all having stress, but just talking openly about that and letting them know that even though that's present, that you've got this, and that we're all going to make it through, and you can come to me when you're not feeling great about it, and I'm going to listen to you, and we're going to figure it out together.
Yeah, that's great. So that is all the questions I have for you. Is there anything else that you would like to say?
I think the other piece too, and I've actually just noticed this with some of my close friends who have children trying to establish routines, they've also tried to get really creative about things that kids can be doing. And that's another thing that I think families can do to help during this time. I think we can see it as there's an opportunity here. There's an opportunity for all of us to maybe put our phones down and to think of something, play some board games, establish some new things and activities that we maybe haven't had the chance to or the reason to embrace lately. It's a time to everyone to take a breath and maybe create something new that can come out of this that is positive. And so there's a way to think about this that isn't the sky is falling. There's a way to think about it. And how do we take this as an opportunity to do things differently that maybe we'll keep in place even after this is all over? What do we like about being together and trying to find that silver lining? And I think that's something that can be helpful too.
Yeah. And I always like to think about how technology has changed children. And I
Yeah.
know that one of the negatives is that there's been research that shows empathy and the development of empathy has been an issue with all of the technology. But this could be an opportunity to open them up to human communication again and connection and developing empathy on an intimate level because you're stuck with people,
Yeah.
right? So
Absolutely. Mhm.
there's positives to this.
Yeah. Yeah. And this also is an opportunity to really model for children and teach them, you can navigate uncertainty. Even you can navigate being uncomfortable. And being uncomfortable doesn't mean the world is ending. It just means we can tolerate some uncertainty and we can be a little uncomfortable and we can still find those silver linings. We can support each other. What this really looks like when you dig in, and how do you come out of that with some positivity in place? I think there's a lot of opportunity right now if we choose to grab onto it.
I agree. Well, thank you so much for joining us today. I will be posting this video on all of our social medias next Tuesday, so you'll be able to find it. And yeah, I'll let you know when it's online.
That's fantastic. Thanks so much for talking with me today.
All right. Thank you. Bye-bye.
Bye.